A ChiroSecure research update. A study published in the journal Spine assessed the effectiveness of spinal manipulation therapy for the management of chronic nonspecific low back pain and to determine the effectiveness of maintenance spinal manipulation therapy in long-term reduction of pain and disability levels associated with chronic low back conditions after an initial phase of treatments. 60 patients with chronic nonspecific low back pain lasting at least 6 months were randomized to receive either 1. 12 treatments of sham spinal manipulation therapy over a 1-month period, 2. 12 treatments consisting of spinal manipulation therapy over a 1-month period but no treatments for the subsequent 9 months, or 3. 12 treatments over a 1-month period along with maintenance spinal manipulation every 2 weeks for the following 9 months. Patients in groups 2 and 3 experienced significantly lower pain and disability scores than group 1 at the end of the 1-month period. However, only group 3, which was given spinal manipulations during the follow-up period, showed more improvement in pain and disability scores at the 10-month evaluation. In the non-maintained spinal manipulation therapy group, however, the mean pain and disability scores returned back near to their pre-treatment level. In conclusion, spinal manipulation therapy was found to be effective for the treatment of chronic nonspecific low back pain. To obtain long-term benefit, this study suggests maintenance spinal manipulation after the initial intensive manipulative therapy.